Dr. Sara Kayat has given a second opinion to a caller concerned she could be suffering with Lyme disease. The GP joined Dr. Ranj and hosts Phil and Holly on This Morning to offer advice to callers. Lyme disease is a bacteria that gets into the body from a tick bite, spider bite or mosquito bite, anything in fact that is carrying the Lyme bacteria, but is often very difficult to diagnose. Early symptoms of Lyme disease often present as a flu-like illness with symptoms including fever, chills, sweats, muscle aches, fatigue, nausea and joint pain. Caller Emma said her GP was at a loss with what to do over her persistent high temperature and exhaustion and didn't know what it could be. She asked the GP what her symptoms could be. "I've been referred to a haematologist. He has come to the end of the road and is discharging me," she said. Emma said the condition is now putting her job at risk. Phil said, "This has changed your life. This is obviously something deeply concerning." Dr. Sara said the caller had had blood tests ruling out the condition, and explained the cause of the condition could be something else instead. "You haven't had an echocardiogram. Sometimes you can get an infection in your heart which can cause a fever," she said. An echocardiogram is a scan used to look at the heart and nearby blood vessels. Other things are connective tissue disorders, so your next step might be to see a rheumatologist, she added. Dr. Sara, Lyme disease is from an infected tick bite. You have had a blood test which has shown it has been negative, but if you have had a bite with a rash I would get it checked. Another caller, Jody, said she was concerned about a lump on her leg, but said she isn't getting any information from her GP. Jody said, "I have Googled it and worried myself about it. I was wondering what I should do now." Dr. Ranj said, "People always panic it is skin cancer. I don't think it's caused any other symptoms. If it is bothering you, you can ask your GP if you should have it taken off. If it is bothering you, most doctors will take it off. You can ask for a referral." Dr. Sara, "You want to avoid taking things off. But a dermatologist would be able to tell you if it is something sinister." Rachel called in to speak to the experts about her 8-year-old daughter, who she said is developing a bald patch. "It is really worrying me and I don't know what is causing it," she told the GPs. Dr. Ranj said, "When you get hair loss in children it can be cause alopecia areata. The hair usually grows back. Some children will have other patches. Could it be a skin infection? Certain skin infections of the scalp could cause hair loss. There are some behavioral conditions where children will pull out hair if they are worried about something or something is going on at school that could be a reason. It could be it will never happen again. If it keeps happening you should see a GP and they might be able to recommend steroids." Lyme disease, torturous symptoms make sufferer feel like her body is shutting down. Watch more videos at video.5la.net.